Access the software. New. Create a new case. Lookup. Retrieve previous cases. The case number is system generated. Enter the patient's name, age, gender, and medical history, including details like smoking, diabetes, etc. Input additional conditions manually, if applicable. Then click New to create the case. Upon accessing the software's homepage, you will find the menu bar on the left. The top left corner features the patient's personal details and examination history. The doctor's name is displayed at the top, while the central area serves as the primary interface for examination and record keeping. Prior to performing a periodontal examination with the software, verify the connection between the foot switch and handle with the software. Press the right foot switch button, then lightly press the switch at the base of the handle to turn it on. When the handle activates, the software will show that the handle and probe are connected. The foot switch is also connected to the software. During the dental examination, we will conduct an intraoral assessment of the patient. Begin by clicking on the tooth's status, then select the appropriate tooth for marking. For instance, if a tooth is missing, choose the respective position, and the system will automatically label the missing tooth. Single tap the foot pedal to switch, and then press the right pedal to proceed to the next tooth. Switch to the measuring. Upon handle activation, conduct a thorough inspection of the probe head. The handle screen currently indicates a 12 mm working distance. Retrieve a disposable mouth mirror from the clinical setting. Align the probe head vertically with the mirror, and apply downward pressure. At this point, the screen will display a 0 mm working distance, returning to 12 mm upon release. This confirms that both the probe head and handle are operating correctly. To begin, select the examination path in measurement. Mode 2 techniques are offered: the 2-point method and the 6-point method. Here is a demonstration on measuring periodontal pocket depth. Position the probe tip at the base of the pocket. Align the sleeve's margin with the gum line to establish the depth at that site. Press the foot pedal once. The software will log the depth and advance to the next measurement site. In cases where the patient presents with substantial gingival hyperplasia, rendering the sleeve unable to reach the gums, and complicating visual identification of the cemento-enamel junction, a manual recording of the hyperplasia values is necessary. To do so, double-click the measurement point and input the values by hand. When the depth at a particular site exceeds 4 mm and 6 mm, the system will automatically generate an alarm sound. Bleeding. To mark the bleeding site, you can directly press the bleeding button on the foot pedal, using the right key to switch the site and the left key for marking. Alternatively, you can switch to the bleeding mode for manual marking. The operation for the pure remote follows the same procedure. Looseness bifurcation dental calculus, plaque and keratinized gingival width. Occlusal trauma. The software offers a recording function. For clinical examinations, employ the standard detection methods, and then document the findings within the software. Upon concluding all diagnostics and data entry, select Generate Report, prompting the system to yield for reports pertaining to periodontal examination. The first report offers an outline of the patient's periodontal status, logging the pocket depth, bleeding, pus, bifurcation, mobility, and other aspects across all measurement points. In addition to an automated periodontal infection risk index (MPSR) classification, report to captures the patient's bleeding curve alterations over successive measurements. Report 3 showcases the plaque dispersion throughout the patient's oral cavity. The fourth report evaluates the patient's periodontitis recurrence risk, suggesting appropriate follow-up intervals. These reports can be archived on the computer in PDF form, emailed when connected to the internet, or printed for case record-keeping purposes by patients or physicians. Delete. Erase the record of measurements. New and search. Initiate a fresh case file or retrieve an existing one. Promo. Built-in promotional short videos facilitate doctor-patient communication. Camera feature accesses the device's rear camera. Use this functionality for clinical photography, if required. Help. Clinicians may consult information on clinical and auxiliary examinations provided. After concluding case examinations and data storage, exit the software. Here is Soga. Thanks for your watching.